Hello, everyone, and welcome to my presentation. My name is Dave Masrell, and I am a Master of Nursing student at Athabasca University. Today, I will discuss the important role that leadership plays in creating a culture of mentorship for graduate nurses. And this is part of my coursework for Nurse 604, Leadership Roles in Healthcare. As a nursing instructor and graduate student, I'm learning how to promote mentoring behavior in the clinical environment and improve the experiences of new nurses entering the workforce. All right, let's get started. This presentation is directed towards new or emerging leaders who work with frontline nursing staff in both urban and rural healthcare settings. These leaders include, but are not limited to, new nurse managers, education or resource nurses, charge nurses, and nurse associates. The defining characteristics of these leadership roles is that they are responsible for delivering high-quality nursing leadership in clinical practice, which supports collaboration in healthy workplace environments. Research supports healthy workplace environments to retain nursing staff, promote safe patient care, and prepare future nursing leaders in practice. In this presentation, I will define the challenges to leading with a culture of mentorship and meeting the practice needs of graduate nurses working on your unit. We will focus on formalized mentorship and the value of transformational leadership for new and emerging leaders building effective mentoring practices. Finally, we will discuss evaluation measures to help you best understand how your leadership impacts mentoring behaviors for your employees. As a learner, you will come away from this presentation with an understanding of the relations between mentors and graduate nurses, your role in fostering these relationships, and a framework for implementing and evaluating your work. Let's briefly discuss the characteristics of graduate nurses within the context of leadership. New or graduate nurses, or GNs, have been described as having 1 year or less of experience. These employees have met the entry-level practice expectations for competencies in areas such as clinical judgment, critical thinking, and time management, but are in a significant period of transition and growth. GNs require ongoing guidance, support, and encouragement from leaders like you as they acclimatize to their new roles. Mentorship is an important part of the GN experience, as it involves the knowledge translation or wisdom sharing from an expert or mentor to a novice called the mentee. Formal mentorship is a familiar setting for GNs, as they have recently completed a preceptorship and are used to working with others who evaluate their practice. There are lots of positive outcomes associated with the formalized mentorship process, including improved interpersonal and organizational skills, building trust and flexibility, and fostering feedback giving and seeking behaviors. As a mentor and nurse leader, you play a critical role, not only by ensuring the success of this cohort, but also by preparing them to one day become the generation of healthcare leaders. Failing to include mentorship in your leadership practice can have significant and negative impacts on your employees, work environment, and organization. A lack of socialization in the GN phase is a contributing factor to nurses leaving their initial employment or position. A robust culture of mentorship for GNs is associated with decreased rates of burnout and improved resiliency. Leaders who do not prioritize the culture of mentorship may encounter difficulties recruiting and retaining their staff. Adverse events and practice concerns for new nurses have been linked to poor or lacking mentorship practices, illustrating how patient care can be compromised. Within your organization, the high costs associated with staff training and high attrition rates are exacerbated by poor mentorship practices. Research suggests that transformational leadership is an effective approach supported by emerging millennial leaders. Using a transformational leadership approach, you can inspire your employees to work effectively by fostering empowering attitudes and commitment to organizational mission, vision, and values. Transformational leadership is associated with improved patient outcomes, improved employee satisfaction, and a positive attitude towards patient wellness and safety. As a leader, you can use a transformational leadership style to promote leadership within your unit and foster a culture of mentorship for GNs. There are 4 steps to employ transformational leadership in practice. The first step is inspiring motivation. This is where a leader communicates a vision for mentorship and builds collaborative relationships, incorporating evidence-based practice and involving employees in decision-making. Individualized consideration translates into consideration for the unique learning needs and talents of your employees, including attention to the mentor and mentee pairing process. Communication with potential mentors and providing feedback and encouragement to nursing staff is important. Idealized influence requires that the leader act as a role model and build trust with his or her employees. In this way, the organization must be seen as credible and reliable entity where nurses want to practice. Intellectual stimulation maintains engagement by prioritizing learning and educational initiatives. This is accomplished by making information and resources available and providing options to support your mentors and mentees. Now I would like to introduce you to Tom, a new GN working under your leadership who has 3 months of experience as a new nurse. Tom has recently emigrated to the area where you work and was internationally trained. This means that he is unfamiliar with healthcare organizations and currently learning local culture while acclimatizing to the nursing profession simultaneously. As a leader, you recognize that Tom is a good candidate for mentorship and you will address his learning needs by employing a transformational leadership approach to build a culture of mentorship in your workplace. Using this example of Tom, think about how you can inspire motivation for employees who are considering engaging in the mentorship process. Communicate your vision for mentorship to your employees and share best practice guidelines. Ask your employees how they perceive mentorship and compare their perspective with your vision. Next, as you focus on individualized consideration, think about the unique attributes of Tom and his colleagues. Who do you think would be a suitable mentor for Tom? Continue talking with your senior nursing staff and assess their level of engagement in the process. As a unit leader, idealized influence provides an opportune moment to demonstrate mentorship in practice. Engage in role modeling behaviors with Tom and his colleagues by being present in the unit and acting as a mentor yourself. Now that you have the attention of Tom and his colleagues, you must continue to maintain engagement. Some practical examples include creating a mentorship committee that plans and evaluates mentorship activities in your unit. Ensure that there are options for staff and emerging leaders who are engaged in this topic, such as e-learning, certifications, and attendance at annual professional conferences. As you evaluate your activities using the transformational leadership lens, there are 3 key areas to consider. Please remember that each evaluation approach will be dependent on contextual factors, such as your practice area and level of engagement in mentorship. When assessing knowledge-sharing behavior, you should focus on feedback between you and your employees. Is there an exchange of knowledge happening in practice? What is the quality or frequency of that knowledge-sharing behavior? As a leader, you may want to elicit feedback using surveys or tools that permit anonymity. Consider individual performance. Have there been improvements or changes in practice? Depending on your practice area, you may have metrics such as employee performance appraisals, attendance, and incident reporting to use as data points when evaluating the overall effects of mentorship on your unit. Evaluating your practice about organizational expectations and benchmarks can ensure that your work is effective. High recruitment and retention are indicators of a thriving work environment where employees feel respected and valued. To conclude this presentation, it's helpful to restate key learning and summarize concepts that have been introduced. Graduate nurses, or GNs, require strong leadership to ensure that they integrate effectively into nursing practice. A culture of mentorship is necessary for recruiting, retaining, and training staff to deliver high-quality patient care. Using the transformational leadership approach, you can inspire a culture of mentorship and motivate employees to excel within your organization. Using the case study of Tom, you should understand how a transformational leadership approach fosters engagement while promoting collaboration for new and experienced nursing staff. Focusing on knowledge-sharing behavior, individual and organizational performance to evaluate transformational leadership in practice, a comprehensive picture of mentorship in your practice will emerge, allowing you to meet the needs of your staff and excel in mentoring practices. Thank you for watching my presentation. Please check out my YouTube channel for more presentations and examples of my student work.